you're alone, then you can't.
I think I actually did see a TED talk about this. I'm trying to remember the details, but basically, animals groups, they ran simulations for in terms of survival, and the groups which banded together did better than groups that didn't band together. So there is something with regards to the survival, but for me, especially coming from a more psych perspective, what I find fascinating about community is how, on a psychological level, we require it. We require that connection, and it's a big protective factor, by the way. When we're doing like risk assessments for any of you who are interested in psychiatry and suicide risk assessment as well. So one of the things that you have to account for is protective factors, and amongst them is social support. So someone who came in with a suicide attempt, being discharged into their home where they have people, a family there to support them, to look after them, is very different to someone who, let's say, is being discharged onto let's say they don't have a home. Very different circumstances.
Very different circumstances. This also applies in orthopedics. We've had a couple of patients that, again, don't have that home support, and they've broken something, they can't mobilize. So that's something to take into consideration when it comes to discharging. Who's going to come and take care of this patient? What's the plan? It's better for them to stay in hospital, because if they do go home, then their mental and physical health will deteriorate.